At Mercy Medical Center, quality is our commitment to patients and the communities we serve. It's part of everything we do. It's who we are, yesterday, today, and tomorrow. This commitment to quality began with our very roots. In 1901, less than 1 year after opening the hospital, the Sisters of Mercy wrote a letter to the Archbishop, promising him they would not be content until Mercy was deemed a peer of the best. For more than 115 years, Mercy has never wavered in its ongoing dedication to that vision of exceptional care. Mercy continues to successfully navigate the changing landscape of an evolving healthcare environment by embracing the Institute for Healthcare Improvement's quadruple aim to improve the patient experience, improve the health of populations, reduce the cost of healthcare, and improve the clinician experience, giving our patients and the community the very best value.
The Mercy story has a fundamental underpinning of quality. It's about what we do, it's about the Mercy touch, and it involves in our entire culture. One of the fundamental tools that we use to measure and improve quality is Lean and Six Sigma. And those are fundamental tools that help us measure, define problems clearly, and assign appropriate resources to them. Lean's also fundamental in how we challenge our leaders to think differently. Every year we have dozens of folks that are coming through and understanding to a greater degree how to do a good data analysis, how to do better statistics, and then how to use that evidence to manage better and achieve better patient outcomes. At the end of the day, the resources that you try to apply to get to the end quality result that you want are first and foremost the people, the technology that supports them, providing the clinical access, so being available on their schedule, not our schedule, and having underlying processes like communication, coordination of care when people leave a hospital.
People are critical to quality. It's not just the provider at the bedside, it's everybody involved, with the whole goal that you're working together to take care of the patient and the community. The people need to have well-defined goals. They need to be supported. They need to be challenged as well.
The technology component, we have lots of pieces of understanding how we measure quality. So there's a data analysis component that goes into that. We have different cancer screening tools. Margin probe, for example, is something that's used in the operating room to make sure you get the entirety of a cancer removed from the tissue.
Paying attention to processes where we break down those silos and we communicate and we develop relationships and we streamline processes so that there are not multiple people trying to do the same thing in different ways.
With Access, we focus tremendously on how much we can work with our existing clinic flow to be able to create more access so people that need to get to a doctor can get in. We spend a lot of time thinking and investing in the building blocks for what healthcare will become, not just what it is today. And that involves having physicians directly involved with helping us set the vision for the future. They're involved in our strategic planning. They're involved in planning for the future. They're involved in defining quality, helping us define quality and what things we're going to invest in. One of the fundamental building blocks for Mercy is expanding into telehealth. There is a growing segment of individuals, and not necessarily age-related, that are looking for different ways to engage in their health care. And that engagement might be an actual video visit, it might be in the form of email, it might be just in the form of communication with MyChart in our Epic medical record, where doctors, nurses, and patients are communicating together. We have specialists in the community that we never used to have. We have cancer oncology, we have oncology specialty, we're bringing in bariatric surgery, lots of specialties that were community demands that previously we had to send out of the community to provide that care.
As we move forward with this new model of care, coordination of that care becomes critical. We need to have longitudinal plans that everybody agrees on and everybody has access to and is aware of.
Instead of looking at the traditional model of medicine, which is I'm a doctor, people come to see me, and you might see a certain number of people per year. What population health is drawing a big circle around all of the people that are involved in the care of your practice, especially those that have not come in to see you.
Tammy McIntyre recalls the day she scored big when she opened her mailbox.
in the mail was this lovely little card from Miss Angie Dolphin that said, hey, congratulations, you're 50 by the way. You need to have a colonoscopy, a tetanus shot, and a mammogram.
The card was from Tammy's healthcare provider, Angie Dolphin at Mercy Care Blair's Ferry. The postcard reminder is a result of the quality measures Mercy has put in place, a way to improve processes and provide better patient care. Tammy took the advice from the card and scheduled a mammogram as part of a girls' day out with her teenage daughter.
I've never, ever had a symptom or anything. I've always been relatively healthy. I was thinking, we're just going to go through the motions and I'm moving on to lunch.
Unfortunately, there were some suspicious findings on that mammogram that showed that Tammy had cancer. That was a rough day.
Tammy learned she had cancer in both breasts. As part of the coordinated care offered at Mercy, Angie quickly scheduled Tammy to meet her multidisciplinary cancer care team at the Hall Perrine Cancer Center to get the best treatment plan in place.
So the advantages of the coordinated care is that I show up and I've got a whole team that's already discussed in detail my prognosis and my plan, and they're in hip sync with each other.
Tammy had chemotherapy followed by surgery and is now back in the game.
Tammy's story it's simple, but it's so inspiring because it shows that the simple process we put into place is working for patients. The seeing her name, sending the postcard out, she called, we scheduled, there was quick follow-up, and good outcome in her situation, which is wonderful.
The future of Mercy is very complex, like many health systems across the nation. It's related to healthcare reform and related to the complexity of expectations of patients. The investments of the future are going to be more around the people involved in the care, the technology that's needed to care for those patients. When you look at great to excellence, that leap is made by understanding what the current environment is. We need to be responsive to the incredible complexity and increasing complexity of healthcare, including those who didn't used to have access to the healthcare system. So Dr. Monica Meeker, for example, is a physician that we hired to focus on difficult, complex patient populations.
When Antoinette Vassar first walked through the doors at Mercy Care Health Partners, she was frustrated and didn't feel well. With complex medical needs, she'd had difficulty finding a primary care provider and frequently went to the emergency room for her care.
I was going through everybody. I went through a million doctors.
Now, this is her medical home with Dr. Monica Meeker.
She's helping me with my heart. She's helping me with my sight. And she's helping me with all my health needs, really.
We have been seeing her quite frequently, weekly for a while, and she has now been able to come and get her medication. She's been getting her lab tests done. We are working on getting some of our preventative exams done as well.
Patients are referred to Mercy Care Health Partners, which provides team-based care, giving patients with complex needs on-site access to 2 primary care providers, nurses, a social worker, pharmacist, and now a behavioral health specialist.
We work very closely as a team. We're all trying to establish a good relationship and a trusting relationship with these patients so that they know that we are here for them. With the complexity of our patients, there's a lot of things that we have to do, a lot of hand-holding, a lot of coaching, a lot of education.
The staff frequently connects patients with resources such as transportation, food, and housing, so patients are better able to focus on their health. Antoinette says it's working, and with guidance from Dr. Meeker, she's feeling better.
She's had done a lot for me. She's awesome. I'm telling you, she's awesome. Soon when I came, she's tucked down all the information, and she's like, well, we're gonna do this, we're gonna do that. We're cool. I love her, seriously. She's awesome.
As you've seen, Mercy has made a steadfast commitment to raising the standard of care in our community. Our culture of care is one of a kind, and our awards and recognitions are testament to our quality, safety, and patient satisfaction. We move forward with confidence, with the foundation of unparalleled quality, service, and compassionate care, set forth more than a century ago by the Sisters of Mercy.
As we move forward here at Mercy, quality is no longer a word, it's a culture. And it's unacceptable to even think of anything we do without including quality.
Today, I had a patient, I saw him at 10:30. He saw cardiology at 11:45. That wasn't even an office time, but they worked him in. That's quality care that I am super, super proud to say that I'm a part of. I'm proud to be a Mercy provider.
Mercy's commitment to quality goes back over a century. We have new ways to measure it, to describe it, to communicate it to our community and our patients, but fundamentally, it is the underpinning of the culture of Mercy, the Sisters of Mercy, and the Mercy Touch.